Welcome everyone to the latest webinar with Dr. Philip Miller from Gotham Plastic Surgery. You are tuning into Rhinoplasty, latest innovations and combination treatments. Today, Dr. Miller will share the latest techniques available for nose rejuvenation and which procedures are commonly combined for best possible results. You'll learn when and why surgery is a better alternative and when a non-surgical option might work. So whether you're here just to learn, whether you've had a rhinoplasty, or whether you're thinking about it in the future, and no matter what the reason, whether you want to remove a hump or the width of your nose, or you're having trouble breathing, Dr. Miller will try to get to all of it and educate you as much as possible. As a reminder for tuning into this webinar, we will be picking 3 lucky winners at the end to receive a certificate towards a rhinoplasty procedure. And everyone who attends this webinar today is entitled for a complimentary consultation, which is amazing. So very generous of you, Dr. Miller.
My pleasure.
So thank you so much for joining us today. Thank you for those of you that are following us on social media and saw this. And let me just go ahead and introduce you to the man himself, Dr. Philip Miller. So in case you don't know Dr. Miller, he is an incredible double board certified facial plastic surgeon. He has been voted best doctors in America and top doctors of New York City almost every single year for, I don't know, at least 15 years. He is on the board of directors for the American Academy of Facial Plastic Surgery. He's written chapters on rhinoplasty for textbooks and served as a guest editor for many papers in the facial plastic surgery peer-reviewed journals. And if you recognize him, you may have seen him because he's on tons of media, everything from the Discovery Channel to the Today Show, maybe in W Magazine, Marie Claire, Wall Street Journal, New York Times. Whatever it is, Dr. Miller is here and he's very excited today to educate you all on rhinoplasties. So Dr. Miller, take it away.
Thank you. What a great introduction. Oh my God. I'm almost blushing. I hope that doesn't come through. So thank you so very much, Reese. I really appreciate it. And I am incredibly passionate about this topic. I really love rhinoplasty. It's such a wonderfully challenging and fun operation because I have to really customize the procedure for every single patient. It's unique to every single individual. I'm not going in and just doing a cookie cutter, doing the same thing over and over and over again. So it's intellectually challenging for me. And I want to share with you many of the things that I think you sort of want to know if you are both considering a rhinoplasty or if you've had one and you're not quite sure, if you're maybe unhappy and you're wondering what you should do next, or just all the things that you can think about when it comes to rhinoplasty. So with that, I'm going to go ahead and share my screen here. Let me just make sure I do this correctly. I think I'm all set. If Risa, you want to give me the A-OK on that? Is that right?
A-OK.
Okay, good. So, what are we going to talk about today? The first thing we are going to talk about is, hey, you know what? Why would you even want to have a rhinoplasty? And maybe, believe it or not, I may be one of the few people who actually talk about why you shouldn't get a rhinoplasty. And I am going to go through a quick top 10 of that. Some rhinoplasty terminology to help you speak with your surgeon so that you can convey what it is you want to achieve. It's really important that you convey that to your surgeon so that they understand what it is that you want to achieve. And that's best done by sharing the same language. We're going to talk about this new non-invasive rhinoplasty called liquid rhinoplasty. I'm going to discuss a micro rhinoplasty, which is actually not many people do. I'm very proud of it. I get patients from just about all over the country to come in to do the micro rhinoplasty. And then your classic surgical rhinoplasty, whether it's primary, tip rhinoplasty, ethnic rhinoplasty, rhinoplasty for older individuals, revision rhinoplasty, etc. If you have any questions, please don't hesitate. Write it down on the question and answer board, or send Risa a chat, and we'll really try to go ahead and answer it by the end of tonight. But with that said, let's go ahead and get right to it. Why would you want to go ahead and get a rhinoplasty? And there's really just two reasons. One of them is because you want to look a little better. You don't like the way your nose looks, and you want to improve the way your nose appears. You may not like your profile, and we're going to see this patient a little bit later on, as I could point down here. Not only didn't like her profile, she also didn't, part of the profile that she didn't like was her chin. Whenever we look at noses, we always look at chins as well, because rhinoplasty is really a profile plasty. It's making your entire profile look a little bit better. So if you don't like the way your nose looks, that's certainly a reason to go ahead and consider getting a rhinoplasty. And if it's not working, if you can't breathe through your nose, there are procedures that don't involve rhinoplasty that will go ahead and improve your breathing. But sometimes the two have to be combined, because part of the reason why you can't breathe is that there's an actual defect which is visible on the outside of the nose, like a depression on one side or the other, or a crooked nose. So fixing your breathing actually also will improve the way you look as well. Now, this is something you probably don't hear about very often, which is, why should you not get a rhinoplasty? And I have my top 10 reasons. I'll go through them quickly, but I think this is really important, and primarily because you have to be honest with yourself. I can try to determine that while we're having our consultation, but you have to be honest with yourself. If you have any of these top reasons, top 10 reasons, then a rhinoplasty, or for that matter, maybe any facial plastic surgery, shouldn't be considered something that you pursue. Let's take a look at it. First and foremost, you don't do it to please family or friends. You do it because you yourself want to go ahead and get the improvement. Okay? You don't do it to make mom or dad happy. You don't do it to make your friends happy. And you certainly don't do it to get more popular, or to be more popular in school, or to get a spouse or a significant other, or to be more social. Well, that being said, there's no doubt that rhinoplasty, and I've seen this so many times, rhinoplasty absolutely can improve one's sense of self-esteem and confidence. And yes, a byproduct of that, no doubt, is an improved perhaps social standing, or perhaps even being more attractive to other individuals. But that's not the reason you get it. That's sort of a byproduct. That's a consequence of it. Number 8 is to get a job or a promotion, right? That's not a reason to get a rhinoplasty. That being said, I am seeing more patients nowadays, because the workforce has increased in age so much, who have actually come in not just for rhinoplasty, but for other procedures, in order for them to continue looking as good as they want to look, because the job market is so competitive. So on one hand, I wouldn't say get it so that you can get a job. On the other hand, I would say, you know what, again, it's a consequence, but it's not necessarily the reason to get it. Number 7 is to make the nose look good in the mirror under all lighting conditions and at all angles. Okay, I mean, that's just not going to happen. I'm a photographer, and one of the things that I love about rhinoplasty and facial plastics is I bring that sense of insight in photography to my facial plastic surgery. And so much of looking good in the mirror has to do with lighting. It has to do with time of day. It has to do with so much. And so you're not always going to look good in the mirror under all lighting conditions and at all angles. Don't do rhinoplasty if you assess the results based on other people's reactions. Okay, you're basing it on yours. If you're going to determine a good or bad result because other people tell you it's good or bad, that's not the right way to do it. You want to be the one who says, this is what I wanted, this is what I got, this is what makes me happy, and you are happy because of that. Don't have rhinoplasty if you don't appreciate that, hey, you know what? This is surgery. And though it's often predictable, it still has some uncertainty based on how you heal. I always like telling patients, I don't leave the operating room without the nose looking terrific, but after that, it's out of my hands. And I'm not quite sure exactly how you're going to heal. I know how some patients heal and how other patients heal differently, and I try to take all of that into consideration. but we're still not entirely positive. And therefore, you have to recognize you're taking, a little bit of a risk, and that therefore we can address that afterwards if things don't go as well as we would want them to, but there is an unpredictability. Don't proceed with rhinoplasty if you aren't absolutely happy with what I call the unified vision. That's the image, that's the vision that you and I have created, the two of us, in what you want to look like after the surgery. Depicted here in this photograph, you can see a person before and the image that I created using the computer of what they want to look like afterwards. You may say, I want my nose smaller and my tip rotated, but my version of smaller and my version of rotation can be different than yours. This is a visual result. And therefore, we both need to be able to look at the photograph and say, yes, that looks good. And yes, that's what I want, Dr. Miller. And if we both don't get that affirmation from one another, don't do rhinoplasty. That's what I call the unified vision. Again, it's probably not a great idea if you're undergoing a difficult transition in your life. Yes, sometimes you may want to have something done because you need a little bit of a boost, but other times undergoing huge transitions in your life is not the best time to undergo a rhinoplasty or other facial plastic surgery. And if you're immature, this is not to be done by individuals, granted, not just in terms of age, being quite young, but also who don't have the ability to recognize the transition and transformation that's going to occur on their face. And for those individuals, I sort of pick them out rather early and sort of say, this isn't for you. But without question, the number one reason not to get a rhinoplasty, okay, without question, is to make a consistently perfect selfie in every lighting situation. I can't tell you how many times patients come in saying, look, I hate my nose, Dr. Miller, and they've taken a selfie of themselves lying on their bed in the worst lighting condition with their head twisted in a contorted fashion, and no nose looks that good. You may be surprised that one of my best patients are professional models. And the reason is, you might expect, well, aren't they the pickiest? Well, they're actually the most reasonable and rational because they know they can spend an entire day, 8 hours, getting photographed with a professional photographer with great lighting and still only get a few phenomenal pictures. Those patients know they're not going to get a great picture every single time with a selfie or without a selfie. So don't get a rhinoplasty for that reason. But I will give you a great tip, and this is worth it. If you really want to get a good selfie, recognize the following. You may have a better right side or a better left side, and you might be right-handed or you might be left-handed. And if you're left-handed and you have a better right side, then you either should turn your head when you take your selfie or use your right hand, even though you're lefty, use your right hand to take a picture of your right oblique face. You'll recognize your selfies are so much better after that. Okay, so I want to now just transition a little bit into rhinoplasty terminology because, again, as I said, it's really important for you to be able to convey to your surgeon what it is that you want to achieve. I referenced the unified vision previously, and that unified vision is your description of what you want to actually achieve. So here's a gentleman I saw many years ago, Honest Abe. And the first thing we're going to do to Honest Abe is we're going to project his tip, okay? And that's called tip projection. So if you feel like your nose is too close, the tip of your nose is too close to your face, you want to project it. If you feel like the tip of your nose is too far from your face, you want to deproject it. That would be bringing it back. That's in distinction to rotating it up, okay? Rotating it up is called rotation, whereas rotating it back down or in the other direction, that's called counter rotation. Now, granted, there are a lot of other terms, but without question, if you just know those 4 terms, those are really, really helpful. And maybe one more. When you say the word straight, do you mean that your nose is crooked and you want a straight nose from the front? Or do you mean that on the side, you have a bump on your nose and you want that bump gone, and you want it straight from the side. So be careful also about using that term. We make sure that we use one term for one type of change and another term for a different type of change. Now we're getting into solutions, and I'm excited about this. You may have heard of liquid rhinoplasty or non-invasive rhinoplasty, and that works great really for the condition in which we're adding to the nose. Now, you can't take a bump. Well, you can take a bump away with liquid rhinoplasty, but what you're really doing is just filling in the two troughs on either side, as you'll see right here. This is an individual who, right on the base of on the top of their nose, has this little depression right here. And if I fill that area in, they look like they have a really nice straight, relatively straight nose. Now, liquid rhinoplasties are not reduction. They can't reduce things, but they can make it look like they're reduced, like I did right here. Now we'll go ahead and take a look at the next patient. I also am introducing this thing called Pronox. This is a wonderful little self-administered nitrous oxide that a patient can take to be more comfortable. And that was really it. That's what I need to do in order to transform this individual from having a little depression on the top of her nose and in the middle of her nose to giving a really nice illusion of a straight nose, even though clearly I haven't removed the bump. I've just filled in the troughs on the top and on the bottom. Here's another individual who wanted his nose to be filled in right over here. And you might not be able to see that, but I think you can. And here's another individual who wanted her nose. You could see her before. She had this really, really scooped out bridge, and she wanted one straighter. Let's go ahead and see how I did that.
God, it looks so good. It looks a lot skinnier too. Wow.
And I've tried giving you a nice little tip. It's a little red right now, obviously, because I keep pushing on.
Yeah, so I was able to not only fill her bridge in so that it was more narrow and it was more projected along the bridge, but also gave her some tip definition so that from the front view, she was able to look a lot better as well. Now we're going to transition briefly to another relatively non-invasive procedure, and this is called microrhinoplasty. Microrhinoplasty is great for those individuals who have a small little bump on the bridge of their nose or maybe on the side of their nose. Not a large one, but a small one. And I use this vibrating machine that goes underneath the skin of the nose, as I'm going to depict here. For those of you, yes, it's in the operating room, but I assure you, you're not really seeing anything. Let's go ahead and take a look.
I'm breaking up with my boyfriend. He needs to come out of the nose.
And it can be done while you're awake.
Over the hurdle.
She goes, take this out, I want it right now. So, this instrument, this is a little graphic for those of you who may not want to watch.
Take it out.
Okay, so I'm underneath her skin right now, and I'm sort of exposing the area, and there it is right there. And now I take our little device here. This is just like a little vibration. Hear that? Good. And I'm putting that right underneath the skin. And she's got a little bump on her nose.
Bye bye bump.
And what are you saying?
Bye bye bump.
Say bye bye. It's going away.
Bye bye.
Now,
so microrhinoplasty could be done awake, as this individual is. I mean, if you wanted to be a little bit more sedated, certainly you can. But it's really great for these scenarios where you have that little bump that's just sort of poking out from the skin and you want to just reduce it. Here she is relatively immediately post-op. And so she's maybe a little swollen over here, but for the most part, it's gone. Incidentally, if you do really like these videos, they are part of my social media. So please join me either at Instagram or TikTok or Facebook. It's Dr. Philip J. Miller. I think it's right here. It is. Look at that. Follow me at Dr. Philip J. Philip with one L, J. Miller. I try to upload entertaining, interesting, educational experiences and information so that you could learn about what we do and also what you can do. Here's another example of someone who's had a little bit of a bump and we went ahead and reduced it using a microrhinoplasty technique. Same thing, the patient was awake and then I went ahead and slid that little device underneath their skin, obviously after anesthetizing them, and then just reduced it using that machine. We're now going to move into surgical rhinoplasty. So yes, the micro rhinoplasty might have been what you consider to be surgical, but I call it more of a procedure. I mean, the only reason it's done in an operating room is because all the equipment is there and it's just a lot easier. But for the most part, it's maybe a 30-minute, 20-minute procedure or so, and then the patients walk in and walk out. Now we're talking about surgical rhinoplasty. And there are many different types. The first one's going to be primary, and that basically means you've never had one before. And what kind of issues do we want to go ahead and solve? Here's one person describing what they want to go ahead and have treated on their nose.
Today we're going to do a septorhinoplasty, and we'll do some subtle, I guess, adjustments on my nose. It'll be a little bit less projected, and then just some smoothing on the sides.
Right. We're just gonna, she's got a little bit of a bump here, so we're gonna take the bump down here, right? And then from the front, we're gonna just make the brow tip aesthetic lines nice and smooth. Bring this up ever so slightly and not change the front that much, right? You like the front, so we're gonna keep that.
Yeah, and you see, it's really important for that conversation to go back and forth because I'm not imposing my will on the patient. I sort of equate myself to being an architect. I'm sorry, a designer, right? I'll give you my opinion of what I think you may want, but I want to hear from you what you want, and we'll come to that unified vision together. Here's what she looked like, I think maybe just a week later.
Going well? Yeah, the healing process has been.
Oh, this was 1 year later.
Seamless, and I could not be happier.
Terrific, terrific. Yeah, and it looks great. You can see that she's got a really nice contour here, and on the front, it's nice and narrow, tip definition, very elegant, beautiful.
Yeah, I really love that result, and she got exactly what it is that she wanted, exactly what she wanted. Someone who has a little bit more of a bulbous tip, that means that the tip of their nose is a little bit wider, skin might be a little bit thicker, also a little bit of a bump. Let's see what we did for her.
I love it. I was just saying how natural it is. And, I mean, apart from the fit that I still look like myself, but it's just much more sleek. But the big thing for me is I love to work out, and I was just saying how crazy it is that now I can actually do the exercises properly because I can breathe too.
The bridge of the nose is just absolutely beautiful, nice and smooth, and this looks just fantastic. I love it.
So as you heard, one of the reasons why we did her case was not just to improve the appearance of her nose, but she also was unable to breathe. And we're going to discuss that a little bit later in the talk. I'm going to talk about what that means. You may have heard of a deviated septum. You may have heard of a septal deviation or septoplasty, and I'll describe exactly what that is. But when you do both a septoplasty and a rhinoplasty together, as you heard the other patient say, it's a septorhinoplasty, and that's where that terminology comes in. On to the next patient. This individual also really could not breathe through his nose. The white area underneath his nose is numbing medicine.
So different.
Oh, it looks fantastic.
Wow.
The bridge is gone. The nose is center in the nose. I haven't taken the sutures out just yet. That will come. Okay, that'll come. Like, you can see the kind of nose was very handsome guy to begin with, but wide, then pinched, then sort of narrowly pinched with the hanging infratip lobule. No good tip definition point, sort of a drooped tip. And here you are now with the, nice profile, really nice tip definition. And from the front, it's a little swollen now, but it's just coming down nice in alignment.
That's awesome.
Yeah, and you want to obviously see these pictures. I want to show you what you look like right after your surgery. You don't have to be that swollen. You don't have to be that bruised. And yet don't rely on just immediate postoperative photographs. You want to see what one looks like years and months later, as depicted here to your right. This is photographs of the individual around a year or so later. I also want to point out that I no longer put sutures in the nose that need to be removed. Those sutures are all dissolvable now, and so there is no need to remove sutures. It also raises the question that you may have heard of an open or closed, or an endonasal or an external rhinoplasty. All rhinoplasties require incisions, and they're all placed on the inside of the nostrils. But an open or an external rhinoplasty connects those incisions to a very, very small incision that goes right between the columella, which is this piece of skin between the two nostrils. In that case, you can lift the skin up in order to expose the underlying cartilages. Again, I'll show you that anatomy in just a little bit. Good. This is an individual who also came to me having a lot of difficulty breathing through her nose. She also had the bump. This is the individual I spoke to before, who had a chin that was a little recessive, as well as had some submental fullness. Let's see how she thinks.
3 weeks later, the nose is still a little swollen. It's going to be on its way down, but you can see a really, really nice profile. You can see that the chin is a lot more projected than it was. We did a little liposuction under the neck as well. How do you like it?
I love it.
Good. And again, you've seen her before and after pictures. I won't go ahead and go over those again. Now, ethnic rhinoplasty I referred to before is someone who wants to maintain their ethnic appearance, but maybe just enhance it just a little bit. And keep in mind, I really love this notion. Remember, ethnic rhinoplasty, or the word of ethnic plastic surgery, is all relative, right? If I were to go to my colleagues in Turkey or Saudi Arabia, I would be an ethnic rhinoplasty. If I went to my colleagues in Asia, I would be an ethnic rhinoplasty patient. So the term ethnic rhinoplasty patient is really just a term that we rhinoplasty surgeons use to say, okay, it's different than maybe what our native population typically wants, and we've adjusted our technique accordingly. So this is a gentleman who you can see has a poor tip projection and a little bit of a bump. Let's see what went on here.
Post-op. Here he is. You can see that bridge is just nice and straight. The tip is projected over the bridge. There's definition on the tip that he didn't have before. Give me a smile. Most importantly, the smile doesn't come down. A lot of times you'll see that where the tip of the nose comes down when the smile. Relax. Tell everyone how you feel.
Feels amazing. Minimal side effects after the surgery. Could not be better.
There you go. Great result. Again, that's an ethnic rhinoplasty result. And rhinoplasty doesn't have to necessarily be for just the young. I often tell my 30 and 40-year-old patients who come in wanting rhinoplasty, or I ask them, you probably wanted this when you were 18, right? And they're like, yes, I really wanted it when I was 18, and my mom wouldn't let me have it, my dad wouldn't let me have it, or I was too scared or whatever. And sure enough, they finally have the time to be able to get it done, even though it's almost 20 years later or so, a little bit more. And that doesn't change even when you're in your late 50s or 60s. This individual came in and said, hey, I've always wanted to have some work done on my nose. The bump's been driving me crazy my whole life. And so you can see here, we took the bump down, and it also improved her breathing. Now, it doesn't require rhinoplasty, that is, to take the bump down all the time or to narrow you at the facial plane. Sometimes patients just want the tip of their nose done, tip of their nose operated on. And in that case, it's called a tip-plasty. And here are a couple of examples. Very, very beautiful woman who just didn't like the kind of bulbosity of her tip, where the tip domes were a little wide. She wanted it to be more narrowed. This gentleman also felt like the tip of his nose drooped. He was perfectly happy with the bridge of his nose. He just wanted the tip of his nose raised up a little bit and made a little smaller. This individual, same thing. She's like, look, all I want is my tip, instead of pointing down, rotated. I'm testing you now on your rhinoplasty terminology, right? I rotated her tip. And in the process also, yes, if some of you thought about it, yes, I also projected her tip ever so slightly as well. As I did in this individual, I rotated her up and actually slightly deprojected this individual's tip. Now, look, unfortunately, this is a complicated, fortunately, it's a complicated operation, because that's what gives me so much joy. But one of the downsides of it being very complicated is that it can be unpredictable. And again, it's unpredictable sometimes, or many times, because of the way that you heal, not necessarily the way of what was done on the operating room table. And so you may have heard of revision rhinoplasty, where we're correcting the original surgery. A lot of times, revision rhinoplasty can be simply thought of as finishing the operation. In other words, at least in my hands, when I'm done in the surgery, your nose looks terrific, right? I didn't go the 11th or 12th step, or maybe the 30th or 34th step, because I didn't have to. It already looked good. But then you heal, and maybe the tip deprojects a little bit, or maybe you form a little callus on one of the bones. And I had to do another maneuver, which I never would have known to do initially. And so you have to come back in for a revision, which in my hands typically is just touching off or adding that one last procedure, which we could have done the first time, but we never knew that we had to do it until you started to heal. But here are some examples of a revision rhinoplasty. This is a person whose nose is quite twisted. This is both from trauma as well as prior rhinoplasty. Let's take a listen.
This individual had had some trauma in the past and a rhinoplasty in the past, but was still left with some asymmetries. You can see one dome is a little higher than the other ones. There's some nostril asymmetry, some overprojection of the nose, and overall sort of poor definition. Here she is now, what is it, 2 weeks?
2 weeks.
2 weeks post-op, and you can see we've got a lot more refinement of the nose. We have really nice bridge tip aesthetics. We've got much more symmetry of the nasal base. Still a little red, granted it's only been just 2 weeks or so. How are you feeling?
I feel great. I can finally breathe. And I cried the first time I actually could breathe fully. It's amazing. You did a fantastic job. I've never been happier.
Yeah, I mean, it's incredibly rewarding for me when patients can have that kind of result. And many of those patients can't breathe through their nose. And the revision isn't just to make the nose look better. It's also because they have always had problems breathing, or sadly, they started having problems breathing after their first surgery. And you can see the kind of changes that occur in this individual's base view. Here are some other examples of a revision rhinoplasty. This person had a bump and a depression that was smoothed out. This individual had a deviation of several of the cartilages on the inside of her nose. Here she is probably around a week or 2 weeks later, and you can see the symmetry that she has at the nasal base. This is what's called a saddle nose deformity. It's an over-scooped portion of the nose, which is the cartilage, and this is nice filled in order to revise that. This is a sort of an overly aggressive resection of the bridge of the nose without addressing the lower half of the tip of the nose. This is called an hanging infratip lobule, and that was raised up in order to give her much more balance and much more symmetry. Now, we've been talking about nasal obstruction for a while now, and you may have heard of the word deviated septum, or what is a deviated septum? Well, if we take the skin off of the nose, you'll see that the nose is made of bone, depicted here in white, and cartilage depicted sort of in this glossy white. The yellow here is just sort of soft tissue. But if we take off that portion right over here, those cartilages that constitute the tip of our nose and the middle third of our nose, you'll see behind that is the nasal cavities, the right one on one side, the left on the other. You reverse it incidentally. And right in the middle, this white line right here is the septum, the partition between the two nostril cavities. And it should be relatively midline. But guess what? Unfortunately, sometimes it isn't, as we'll see here.
Here's the septum, the partition between the right and the left nostril. It's just a piece of plastic, but sometimes it can be off to the left, sometimes it can be off to the right or so. But occasionally it can be bent so severely that it actually bulges into one of the sides, and that's what we have today. And this poor individual had such a difficulty time breathing through his nose because instead of this piece, which should be really thin, it just completely bulged all the way out into one side. You can see this area right there just completely bulged. This is one section. Here's another section. Okay, it should be this thin all the way down, and take a look right here. It just comes out to be almost perpendicular. Poor kid could not breathe. Bony septum, and it goes out. It's incredibly thick, and it just bows out into one side that was completely obstructing this person's ability to breathe.
Yeah, and so it's not just about making the nose look better, it's about making the nose work better. And it's not just fixing one's breathing if they present with nasal obstruction, it's also preventing one from having nasal obstruction after surgery. And those of us dedicated and committed to rhinoplasty are experts in that. And I want to just briefly describe the difference and distinction between a facial plastic surgeon and a plastic surgeon. Now, this is important. There are plenty of plastic surgeons who do amazing rhinoplasties, but plastic surgeons and facial plastic surgeons are trained differently. Plastic surgeons are trained over the entire body. So they're doing breast augmentation and tummy tucks and liposuction on the legs and doing maybe calf lifts or thigh lifts. Whereas facial plastic surgeons have trained for over 5 years. Sometimes I trained for 6 years, specifically in head and neck and ENT, or ear, nose, and throat. So we have extensive knowledge and experience in the anatomy, the physiology, the pathophysiology of the head and neck region in general, and the nose in particular. So most really, really great rhinoplasty surgeons are facial plastic surgeons. That's not to say that that a plastic surgeon, and some really good friends of mine who are plastic surgeons are amazing rhinoplasty surgeons as well. But it's I sort of look at it like this, some handymen can be amazing electricians, but if you want to have something done in your house, you probably want to hire an electrician. Some handymen can be great plumbers, but if you want to have something done in your bathroom, you probably want to hire a plumber. So without question, don't get me wrong, certain plastic surgeons who have dedicated themselves to the art of rhinoplasty perform great results. That being said, the facial plastic surgeon is someone who by nature has that extensive and amazing experience and training to be a rhinoplasty specialist. Now, what other kind of criteria can you use in determining who you want for your rhinoplasty surgeon? And this maybe has to do with board certification. You may have heard of that. What is board certification? It doesn't mean we're lying on a flat board. What that means is that different specialties have created an examination, both oral and written, that they deem to be what would be required in order to claim a certain level of competence. And you don't have to sit for your boards. You can do all your training. You can go ahead and graduate from your residency program, and you can go right into practice. You do not, as a medical doctor, have to actually go and sit for board certification. It is a voluntary maneuver. It's a voluntary act. But those of us who do go in and sit down, it's a rigorous activity. We have to sit down, take a written examination, and then an aggressive oral examination as well. And then we're deemed, if we pass, with the status board certification. And I'm proud to say that I am not only board certified in otolaryngology, head and neck surgery, but I'm also board certified in facial plastic and reconstructive surgery. So that's where the term dual or double board certified comes from. So, we've talked a lot tonight, and I've tried to condense a lot. There's so much I didn't talk about, and I see there are a number of questions here, and I hope we can get to them in the next couple of minutes. But we talked about why you may want to get a septoplasty or rhinoplasty, why you shouldn't get one, and this is really important. Again, ask yourself, be honest with yourself. Should you get one? We've talked about different terminology to help you talk to your plastic surgeon and facial plastic surgeon about what you want. A non-invasive liquid or a non-invasive microrhinoplasty, as well as all of the different forms of surgical rhinoplasty. And we touched it off a little bit with the septoplasty as well. So, I'm so happy and grateful that you joined this evening. I am passionate and I absolutely love the field of rhinoplasty. And I am committed to this operation. It's one of my favorite, as Risa mentioned today. I did one just this morning, and I have two tomorrow. The one I did today was somewhat complicated. It even involved harvesting some rib cartilage. That's not always the case, I assure you. But I really, really love it. And now I'd like to open it up. I'm going to go ahead and close my screen, I guess. And Risa, if you're there, you can come on back and you can join us, and we will answer some questions.
Thank you so much, Dr. Miller. Wow, that was so much great information and a really great overview. So let's get to it. We do have a number of questions. Anyone else that was waiting to the end, this is the time. Start populating your questions in the Q&A. All right, here we go.
Oh, yeah. Okay.
Can I get a liquid rhinoplasty if I have a very hooked nose?
Yeah. Oh, wait a second. And I see, and can liquid rhinoplasty be used for both tip deprojection and rotation? Okay, so let's talk about this. Liquid rhinoplasty can give the illusion of a reduction, right? Because if it looks like you have a bump, I can give you the illusion of taking the bump down, but I'm doing it by filling in the trough or the depression above and below the depression. So I'm actually making the nose bigger. Liquid rhinoplasties make the nose bigger. They don't make it smaller. So no, it can't deproject the tip of your nose. However, I can maybe do some maneuvers which make it appear as if the nose is deprojected. Perhaps, for example, if it's pointing down, I could actually put a little filler higher up and give the illusion of a rotation and maybe a deprojection. So I wouldn't say entirely no. It is a case-by-case basis, but overall, the general idea is liquid rhinoplasties make the nose bigger, even though the illusion is that they might look like they're smaller. Whereas surgical rhinoplasty can make them bigger, smaller, wider, narrower, whatever the range.
Got it. So for someone that's considering a surgical rhinoplasty, could it be a good idea to get a liquid rhinoplasty first, kind of try it on?
Yeah, that's absolutely a very common scenario that occurs in my practice. In fact, I even do something else, which is I offer, if they don't want to incur the expense of even undergoing a liquid rhinoplasty, I actually will inject just water or saline in the nose. Forget about the expense. They also may not necessarily want it, because once you get the liquid rhinoplasty, you're walking around it for almost 9 months or so, maybe even longer. So if patients are curious about what a liquid rhinoplasty can do, I can simulate it. Besides using the computer, I can simulate it by just injecting saline, which will dissolve through, just get absorbed in your body within 5 or 10 minutes.
Wow, that is so interesting. That's awesome.
Yeah, I do that for the chin as well. If you're not sure if you want to have a chin implant or cheek implants, that's a really great way for you to sort of see, besides doing it using imaging, for how you would look with that augmentation.
Oh, that is a great reason. All right. So how limiting is thick skin in a reduction rhinoplasty?
Yeah, it's a great question. Obviously there's so many issues and topics that I could address, and maybe we can address that on rhinoplasty, what you need to know, part 2. But thick skin poses the following kind of problem or dilemma. Okay, so imagine a really thick blanket, and imagine also just a thin sheet. Okay, if you take your 2 fingers and you put it underneath that thick blanket, it's only going to appear so defined, because that thick blanket is going to obscure how defined those 2 fingers are. In fact, you can even put 1 finger up sometime underneath that blanket, and it's still, because the blanket is so thick, like a down comforter, it's still wide, right? Whereas if you put your maybe just 1 finger up underneath a sheet, a single bed sheet, you can see the outline of the finger very, very well. So unfortunately, thick skin, while sometimes it's good because it hides irregularities, other times it can be frustrating because you can only get so much definition.
That's so interesting. And if you guys didn't watch our last webinar on My Elevate, he also taught a great trick with 1 finger and 2 fingers there. You have so many of these. What are the chances of new breathing problems occurring from a reduction rhinoplasty?
Yeah. So, first of all, your question is, what are the chances? So probability wise, I can't really answer that, right? I can say that it's important for your surgeon to recognize your predisposition to getting it. And a classic example was today. My patient today had no nasal obstruction. They wanted a smaller nose. And as I looked in their nose, I knew, after I narrowed their nasal bones, I knew they were going to have difficulty breathing. I don't need them to wake up and look at me and go, "Hey, doc, I was fine before. Why can't I breathe?" So I prophylactically, I proactively went ahead and did the necessary maneuvers or septoplasty in order to prevent that from occurring. And that's why I brought up the topic about going to either a facial plastic surgeon or a plastic surgeon who is really committed and devoted to doing a lot of rhinoplasty, because that's a kind of individual who will know that ahead of time and will be able to prevent it from occurring.
Got it. So for something like that, would this possibly be covered by insurance?
If here's something really interesting. So the answer is, if you're coming in with nasal obstruction, yes, insurance may cover it, not the rhinoplasty part, but the nasal obstruction part. But years ago, I tried and I just gave up. But I used to try to get the functional part of the nose treated or covered by insurance when they went in for the rhinoplasty, because I said, listen, if I don't do the septoplasty, the functional part, then they're going to have nasal obstruction afterwards. Why are we making the person get a rhinoplasty, which you're not covering, and then afterwards have nasal obstruction, and then come back to me for a second operation that you will cover? Well, why don't we just sort of, that's ridiculous. Trust me, she's going to have nasal obstruction, or he's going to have nasal obstruction. I'd like you to cover that now. And, somewhat understandably, the insurance companies go, no, we're not doing that. So.
Got it. So do patients, you did touch on this question may have come before, but do patients often get chin surgery at the same time as a rhinoplasty? And if a patient has TMD, would either the rhinoplasty or chin surgery affect it?
Yeah. So one of the most common procedures done with rhinoplasty is chin augmentation, chin implants. And again, because rhinoplasty, besides changing maybe a crooked nose from the front or decreasing the overall width of the nose from the front, also involves really taking a bump down or changing your profile. And the profile view has the profile is remarkably affected by the position of the chin. Okay, if a very, very retruded chin, one that goes back very far, will make a nose look bigger than it really is. And you can make a nose that looks like it's over projected to be absolutely normal without even doing a rhinoplasty. All you have to do is add a chin. What was the other question
TMD.
about? So the TMD, which would be temporomandibular disorder, temporomandibular joint issues, which is maybe a clicking or pain here in the joint that's right in front of your ear. No, rhinoplasty has no effect on either improving or worsening TMJ, and neither would a chin implant.
So is there a way to tell if your septum has issues without going in surgically, just to see if it needs surgery?
Yes. You may have a tough time doing it unless you look up your nose, and that can be a little complicated. But let me say something which may surprise everybody. I'm telling you right now, everybody has a deviated septum. Almost everybody does. Almost everybody. It's not the presence of a deviated septum that's an issue. It's the presence of having symptoms. If you have symptoms with the deviated septum, then yeah, doing a septoplasty or correcting that may very well, along with some other maneuvers, improve your breathing. But the presence of a deviated septum alone doesn't necessarily mean that you have nasal obstruction. And I go by the adage, if it's not broken, don't try to fix it. So even if I see someone has a deviated septum preoperatively, if they don't have breathing problems and I don't think my maneuvers will have any effect on their breathing, I don't fix it.
Great. We are so lucky to have this conservative approach, because not all surgeons would say that, guys. All right, here's a good question. How bad is the bruising? Realistically, how long before it goes away? When can I look presentable and go back to work?
Well, isn't that great? I mean, I don't have to tell you, my work showed itself. I mean, one of the videos, so many of those videos, or maybe half of them or so, were right after the cast came off, and I was showing you. So bruising, I often say, has to do, in my hands, more with the patient than me. I'm doing more or less the same technique, right? But the patients come to me with sometimes taking aspirin, or sometimes taking a Motrin, or sometimes taking extra fish oil. So, and some patients just bruise, and there's nothing you can do about it, right? That being said, I don't want to make it appear as if I never get patients who are bruised and that it's never. There's absolutely scenarios where it may happen, but as you can see, it doesn't have to happen, and it often can be avoided.
So how soon can most people get back to work?
1 week. Yeah, typically you'll wear a cast on your nose with some tape for 1 week, and then the cast comes off in 7 days later, 1 week later, and patients are typically going to work from their appointment with me or the next day.
Got it. And how long after the surgery do you have to stay away from doing cardio exercise?
Yeah, I some people will say 6 weeks, people will say 4 weeks. Here's what I say: use common sense, right? If it hurts, then whatever you're doing is too much. If it doesn't hurt and it doesn't cause swelling, then you're fine. So take it easy for maybe a week, 10 days, maybe 2 weeks, but after that, slowly increase your activity level. And if you're finding that after doing your calisthenics or after you're doing your Stairmaster, you look in the mirror and it doesn't look swollen and you're not in any discomfort and you're not in any pain, then go ahead and increase the resistance and increase the frequency. If, on the other hand, as has happened once, I operated on a dear friend of mine. She was a quick recovery. I'll never forget it. She went out and had 3 days later, she was already out shopping on Fifth Avenue over here, and she didn't care. She had the cast on. She didn't care. Cast came off. She looked terrific. And then I saw her maybe 2 months later. Socially, we were at dinner one night, and I looked at her and I said, "What did you do? Something's wrong." And then she smiled and said, "That's so weird. I started doing hot yoga." And I said, "You can't do that now. That's just stop for a couple of weeks, go back and do your other exercise, and then give it another 2 or 3 weeks, and then go back." And sure enough, all she needed was another month or so, and then she was able to do hot yoga again with no effect at all on the size of her nose.
Got it. But that's why you stay in such close communication with your patients, and they can call you.
Oh God, what do we have? Well, nowadays, we remember the days when all it was picking up a telephone. Now you can telephone, email, text, fax, Facebook Messenger, Instagram Messenger, TikTok, you name it, we've got it. We'll communicate with you.
Got it. Okay, last recovery question. How long before you can start wearing these lovely glasses again?
It does depend partly on how heavy the glasses are and whether or not the bones have been repositioned. So if the bones have repositioned, the way I do it, they're typically pretty sturdy anyway, and they can withstand very light glasses going on them. So maybe 2 weeks. If they're really heavy glasses, then I just have you wear the glasses and just tape them to your forehead for a little bit.
Sure, that's a nice look.
Yeah, exactly. Well, a colleague of mine, and many of you know, a good friend of mine, Paul Nassif, who's out in Beverly Hills. Paul sent me a crate of these devices that he had created, which were basically things that you wrapped around your head and that you could put your glasses, so that it was sort of a hook, so it rested your glasses so that it wouldn't be. Paul's a big rhinoplasty surgeon as well, and I don't know. I don't think it ever took off, but I got to give him, 2 thumbs up and 5 stars for being imaginative and creative in order to come up with a solution.
Love it. All right. We have so many questions left and only a few minutes left. We'll try to get to as many as you can. Please remember, we will be picking a winner, 3 lucky winners. So stay on, and everyone coming to this webinar gets a complimentary consultation, Dr. Miller. All right. Let's see. For dorsal humps in the bridge of the nose, how do you go about shaving the hump down while keeping the nose shape natural?
That's a great question. And again, a topic that I want to briefly discuss because it's a really hot topic. So to answer your question, how do I do it? Again, the height of the bridge of the nose is, to me, very dependent upon where we want to put your tip of your nose first. So we've discussed where we want the tip of your nose, and the bridge of the nose is going to be relative to that. And I always talk about, do you want it to be straight? Believe it or not, some patients still want a little bit of a bump, and other patients want what I call a whisper of a scoop, and some patients really want maybe more of a scoop. There are a number of different techniques. I use a technique where it's actually if I can be so graphic, it's a reciprocating saw that won't cut through soft tissue, but it glides through like a hot butter through knife. It just glides through that area and leaves a beautiful, beautiful dome in order to restore that contour. Now, there is a huge trend right now, and I hate the term, And I think it's a very, very misleading term. And many of you may have heard of it. It's called preservation rhinoplasty. Now, the reason why I find it very misleading is it's really a technique. It's not a whole different kind of rhinoplasty. It's just a technique to take the bridge down. And what they're preserving is the connection between the bone here and the cartilage here, but at the expense of destroying, if you will, many other attachments. So they're preserving the attachment that I just said I sort of sliced off. They're preserving that. But the only way that they can do that is by very aggressively deconstructing and resecting many other components of the nose in order to keep that intact. I'm not criticizing the technique. I'm just saying that I personally find the term preservation rhinoplasty very misleading, and the term preservation dorsal reduction very misleading, because you're actually disturbing more than you're preserving. But what you are preserving is this junction that has typically been removed in one way or another in the traditional rhinoplasty. Oh, you're on mute.
Sorry. Last question before the winners. So first, Linda Perella says, hi, Dr. Miller. She's curious
Hi, Linda.
how many revision rhinoplasties you do in a year, because she had a septorhinoplasty 20 years ago and her deviated septum has returned. She'd like to fix it and would like the tip to be a little bit more refined, but is curious how to avoid another deviation again.
Yeah, well, there's, again, brings up a whole bunch of topics here in the terms of, you may have heard that a lot of people talk about septal memory. So yeah, we put the septum in the midline and then there's memory and it sort of moves over to the other side. Well, there's a lot of discussion about that. Is it really that there's memory, or are there other factors? We have two faces. We don't have one face. We have a left side and we have a right side, and they each have muscles. And those muscles are exerting different forces on this midline structure. And so sometimes it's not the fact that the cartilage has memory as much as maybe there is a pull on one side compared to the other, which over time shifts the nose in one direction over the other. So again, depending upon the person, there may not be a guarantee, but there can be many maneuvers to assure that it won't happen again. 20 years later is a very common. I mean, I see patients anywhere from 6 months, which I think is a little too early, to 20 years after surgery who were requesting revision rhinoplasty. I would probably put it at this point, probably half of my rhinoplasties are revision rhinoplasties, not my own, I'm happy to say, but there are others who were unhappy with their results. And to add this last thing, the vast majority of patients who are unhappy with their results claim the reason is because they didn't feel like the surgeon understood what it is that they wanted to achieve. That's why I impress upon all of you so much. Take the time to really convey and be assured that your surgeon understands what it is that you want to achieve, and don't rush into this. Okay, go back and see them 1, 2, 3 more times. I tell patients all the time, I'd rather see you 3 or 4 times before we do the surgery to make sure that you know what it is you want and I know what it is that you want, rather than doing it hastily and you being disappointed afterwards.
Absolutely. Great advice. All right, we have more questions. We will try and answer these on Instagram and social media. So please make sure you follow us at Dr. Philip Miller with 1 L on Facebook, TikTok.
Dr. Philip J. You forgot the J. You got to put the J in there. Dr. Dr. Philip with a J. Oh, we should have a little QR code or something like that, or hyperlink or something up here.
I will pop it in the chat right now.
Oh, okay. Thanks. Yeah, it's Dr. Philip J. Miller. And again, I love seeing people follow, and we really try to engage. And shout out, by the way, to April, who is in the office and does my social media. She's amazing. She helped me put the presentation together. She's the one who takes all those lovely videos. April, thank you so much for all your hard work. Tanya, thank you again as well, who's our patient coordinator. She helped as well in sort of arranging this evening. And Risa, of course, my endless gratitude to you as well for hosting this evening.
So much. All right, so everyone that joined tonight, Dr. Miller is generously offering a complimentary consultation, which is a $400 value. So there is no reason not to take him up on that, whether you're local or remote. He sees patients from all over the world remotely, so we can accommodate you. But we also have 3 winners. So first, let's start with the 2 lucky winners that will win a $500 certificate towards a rhinoplasty procedure. And I am popping you, I wish you could see in a little website to pick it. And the first one's going to go to.
Oh, what? Can you say, be careful, you can't say their name. I don't know. Can you?
To a Jessica S.
Okay, there you go. There you go. Do that.
So
Okay.
Jessica S., you are number 1.
All right. Good.
Good job. Congratulations. And then number 2, we have Ananya R.
Oh, good. Congratulations to both of you.
Your name too much. You two both win the $500 certificate towards a rhinoplasty procedure. And now, drum roll, please, for the $1,000 one. I have a Shirley D.
Oh, congratulations, Shirley D. I'm really excited for you. Congratulations. I look forward to seeing you all virtually or in person here or in New Orleans.
Yes.
Yeah, I'm excited.
So thank you so much to Dr. Miller. Thank you for everyone that tuned in. Thank you for those of you that follow us on social media. And we look forward to meeting you virtually and seeing if Dr. Miller may be able to help, and wish you a good rest of your evening. Thanks again, Dr. Miller.
And thank you, for all of you, all of those of you who were here this evening. Thank you so very much. And please, if there's other topics you want to hear about, we'd love to hear from you, and we love making them these webinars for you.
Good night, everyone.
Good night. Bye-bye.